Before long, 8 Ukrainian nurses and their families who are fleeing the war in their country will be taking a journey of some 6,000 miles to call Louisiana their new home. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. The nurses' journey to relocate to a safer place comes courtesy of Ochsner Health in New Orleans, which has partnered with several organizations to make it happen. Global Nursing Partners, which brings internationally experienced nurses and U.S. healthcare facilities together for permanent positions, is among the groups Ochsner has worked with, along with CGFNS International, the American Hospital Association, and the American Organization for Nursing Leadership. Together, these groups are providing two very valuable services. The Ukrainian care providers will receive refuge and protection from an escalating conflict, and communities around New Orleans and across Louisiana are getting trained nurses at a time when the U.S. does not have enough nurses to meet the demand. Warner Thomas, President and CEO of Ochsner Health, recently sat down with Robyn Begley, CEO of the American Organization for Nursing Leadership and Chief Nursing Officer and Senior Vice President of Workforce for the American Hospital Association, to discuss this relocation initiative and what the future may hold. This podcast was recorded in mid-July at the American Hospital Association's annual Leadership Summit in San Diego.
I'm Robyn Begley, CNO for the American Hospital Association and CEO for the American Organization for Nursing Leadership. It's my pleasure to have Mr. Warner Thomas join me. Warner, could you say a little bit about yourself?
Sure. Warner Thomas. I'm the president and CEO of Ochsner Health. We're based in New Orleans, Louisiana. We're the largest health system in the Gulf South, a not-for-profit academic medical center. We have a large medical group, over 2,000 employed physicians in the Gulf South region.
Thanks so much for joining me. It's a pleasure to have you here. I understand you have a great program underway where you will be providing humanitarian aid and opportunity to Ukrainian refugee nurses. Can you share with us what you're doing and how Ochsner got involved with this initiative?
Yeah, we're really excited about this initiative, Passport to Liberty, which was brought to us by CGFNS International. And they had really brought the opportunity to bring, they had up to 30. We're going to start with 8 Ukrainian nurses and their families to the New Orleans region. These are families who one of the spouses is a nurse, and we'll be bringing them to the U.S., helping them immigrate to the U.S., and we'll also have them begin to be part of our nursing colleagues at Ochsner Health.
So, Warner, that's just wonderful to hear. Louisiana is perhaps not the first place you think of when you think of Ukrainian refugees coming to the U.S. So what motivated you to do this? And is there any personal connection for you?
You know, I think it's really just a situation. Number one, we think it's the right thing to do. This is a great thing to do, to just be a good citizen and to help folks that, who are going to leave the Ukraine or who have left the Ukraine and are looking for a place to be. The second thing is, obviously we have huge workforce needs. I mean, this is another way that we can continue to build our nursing pipeline and we can bring more folks here that want to be part of our team. We're excited to do both of those. So when the opportunity came up, it's something we jumped at, quite frankly. As I said, we're starting with 8. We'd like to do more, but we will be, building out a whole set of services to help them integrate into our organization, but really, more importantly, integrate into our community to make sure they're set up to be successful as citizens in the area.
And I guess that too, why 8 families will be, located to your area together. That's really important that the social support exists. So you mentioned a little bit about how you're preparing. Anything that you think your staff needs in order to prepare for, maybe from a clinical perspective, that the nurses will need?
Well, I think we're early in this process right now, so I think we need to understand more about the training that these nurses have gone through. We understand they'll all be, they'll have English, speaking capabilities. So we'll put them through our normal process that we would for any nurse that we would hire. But certainly the whole focus on how we integrate them into our community, how we help their children get into schools, help them with housing and lodging and that sort of thing. There's really a whole program that's being built around this initiative so we can help them be successful as they come into our community, and certainly help them be successful as nurses in our organization.
Yeah, that's fabulous. And I know from my experience with CGFNS International, I mean, they do everything to vet the nurses, their education, their credentials. So, if they deem them, ready to come to the U.S., I mean, they're a very reputable organization, and I know that they will work hard to help with that.
And I think that's one of the things that was really attractive to us to work in this partnership is they've done a lot of that work, so we feel good about them as a partner. And, we've had a great relationship there. And once again, I think this is a start, not a finish. We'd like to bring more and welcome more nurses and more families into our region. We'll start with these first 8, and then we'll certainly move on from there and look at other opportunities.
Yeah, there is a lot of red tape. And I know the 2 agencies that we mentioned are really experienced in not only, vetting clinically the requirements and the credentials, but also, with the State Department to make sure that there's the legal access for the refugees to come in and work. And I know that Global Nurse Partners are also a real large part of that. So that's excellent. Any idea on when we think they'll be coming?
This is still relatively new. I would say it's an evolving situation. We're supposed to know more in the next 5 to 10 business days about some of the timing. I think it's probably in the next couple of months that we would anticipate this. We're certainly very excited about it. I think it's a great opportunity. And once again, I think our organization has always been known to do things that are innovative and different and new. I think this is just another one of those opportunities that Ochsner is stepping up to do something new and different. I know there's other organizations that will be part of this as well going forward, but we certainly are interested in blazing the trail and making sure we do this right and making sure it's a comfortable situation for the families and the nurses, and look forward to learning as we go through this process in the coming weeks.
When I think about, Hurricane Katrina and the devastation that your area experienced, it just seems it's very heartwarming that you are all in a position now to help, another area that has certainly been devastated. Obviously not a hurricane, but
Right.
I'm sure that warmth and empathy of your citizens and your employees, will really come through with this. So at AHA and AONL, we are partnering with CGFNS International and Global Nurse Partners to promote the Passport to Liberty initiative that Warner just outlined. It really is a win-win, as you mentioned, for our healthcare organizations and also for the nurses and their families. Are there any other ideas that you think we can do at, or we can execute at AHA and AONL to further this worthy cause?
Well, I think that, certainly there's huge needs to bring more nurses into the United States. I'm sure there's a lot of folks who have left the Ukraine that have these capabilities and are looking for these types of opportunities. So I think the more we can broaden this initiative, I think it's really a win-win, right? And certainly we have lots of organizations in the United States that need more nurses. Certainly, there are challenges with immigration. We'll work through that appropriately. So I think anything the AHA could do from an immigration perspective would be great. But once again, I think this is just something that as we learn more about it, if we could expand it and grow it, I think it's a great opportunity for everyone involved.
Yeah, our idea at the AHA is that, we are starting with nurses. We have the pathway outlined and the partners, but we really think that there's opportunity to look beyond nursing. So, we know that there's a number of clinical folk, but also, support staff and others in our hospitals and healthcare systems. And we all know the workforce challenges. So this may be, again, a win-win for not just nursing, but also as we look to what other positions we could also be recruiting for. And I guess I'd like to add, too, that we are very sensitive that we're not, quote unquote, poaching these nurses. The nurses and their family have been displaced. We've been informed that there are no homes for many of these nurses to go home to. So, this is a medium-term action, I guess, where we would hope that they would stay for as long as possible But the political situation was obviously, very tenuous in their home country.
Right.
So this is something that they were looking to do anyway.
Yeah, I think this is something folks you want to do or understand is it's a 2-year commitment that they'd be making, and I think they're excited to make that commitment. I mean, certainly we would hope that they would want to stay longer, and we'll be doing everything we can to recruit and retain them like we do with all of our nurses and all of our clinicians. But you're right. I think this is something that is a win, and it's something that folks wanted to make a move. They don't have a good situation where they are, so this is an opportunity to do something very, very good for these nurses and their families, and also to help our patients at Ochsner.
Well, I know there are many organizations that are lining up behind you. We're looking to Ochsner to be, the leader in this, and we'll be learning from your experience. And I just want to thank you so much on behalf of AONL and AHA for stepping up to the plate and being the first. And any words as we close, Werner?
No, I would just say a big thanks to Tracy Skiro, our Chief Human Resource Officer, and Tracy Moffat, our Chief Nurse Officer, really helped to spearhead a lot of this in their teams. They've done a great work there, and as we learn and go through it, we'll certainly share the lessons and look forward to working with others to expand this initiative.
Thanks very much.
Have a good night.
Thank you.